I'm Greg McIntyre with the McIntyre video blog and Elder Law Report. And again, I'm honored to be here with Joe Seidel, who is the Division Director for Bayada Home Healthcare, one of the largest and the largest privately owned home healthcare providers in the nation, with almost 300 offices nationwide, doing about $1 billion projected this year. So it's an honor for us to have him as a guest today, and wanted to discuss who pays for home health care. Unless I have, I guess, money buried in the backyard, or I guess I could pay for it with my retirement funds, but what are the different options, Joe? How can I pay for it?
Yeah, so that's a great question, Greg, because and we sit down with people and try to understand what their needs are and what they need. But obviously, one of the first choices is private funds. The individual has the money to pay for it, and so they pay for it. That's obviously going to drain their resources, but that is one way that home care gets paid for. Another way is through, if the person's a veteran, through the VA administration.
Okay. I'm a veteran, so the VA might come in and pay for my...
They would. It's called the Home and Attendant Program.
Okay.
And those benefits are available in an assisted living facility and or home care. And the way to get the ball rolling with that is you go to your veteran, to your local VA, and you talk to your primary care physician at the VA, and they start the ball rolling to get the VA benefits. But typically that gives relief for, average right now we're probably getting about 6 to 9 hours a week, 2 or 3 days a week of 3 hours of service. And for those individuals, it may be just what they need to kind of be able to keep them at home. And, unfortunately the hours aren't any longer than that. But we do have a number of VA clients that are able to stay at home. We go in and help with the activities of daily living and assist them with that. And so the VA program is a great benefit for the veterans who qualify. And one of the qualifying factors for VA is you have to have served 1 day in a wartime period.
Okay.
Now, you didn't have to be there.
Okay.
So, but you had to, Korean War, Vietnam War,
Gulf War?
Gulf War.
I would qualify.
So if you served 1 day of service during a wartime
I
period,
did.
you qualify for this program.
All right.
So there you go. So another avenue that we have a lot of people pay for their services is through long-term care insurance policies, and those policies kind of range all over the board. And we have, some of the policies are great, some of them are not so good, but there's some more standardization with the policies now than there were when they first came out a number of years ago. But you have to, with a long-term care insurance policy, you're going to have a physician's order, you're going to have at least 2 activities of daily living that are being performed each day to qualify for them. Couple things with a long-term care insurance policy that are important is the elimination period. That's like your deductible, and it's usually the number of days. You're going to have a 30-day elimination period, a 100-day elimination period. One of the things that can help people save money through that elimination period is they don't talk about how much money you have to spend per day.
Right.
And so we have people that strategically, get what they need in a shorter period of time, and then when their when their elimination period is exhausted, then they can bump up to the number of hours that they qualify for under their long-term care insurance policy.
Right.
So again, preserving their assets, it's a great way to do that. If someone's looking at a long-term care insurance policy, they want to look at an inflation rider. If you don't have that and you have your policy for 30 years, you're going to get $50 a day. Well, in 30 years, $50 a day is not going to get you a whole lot.
Right.
So look for an inflation rider. What are the daily limits? Those are some things to look for. But we have a number of clients that we have that pay for their services through long-term care insurance policy. Great program, and really preserving their assets as well. And I know that's one thing that your law firm is definitely involved in.
That's what we're all about, is saving the farm.
Yeah. And another, we've talked on another podcast about Medicare Medicaid, and,
Sure.
and those benefits are available. The other one is private insurance. And private insurance, depending on what the policy says, most of the time it does not cover custodial care. And people think, well, that's not a problem, I've got this insurance policy. Well, a lot of home care falls under what is called custodial care.
Okay.
So private insurance policies typically don't pay for the assistive care, personal care type services. Now, there may be a skilled nursing benefit in there that would pay for skilled nursing services such as trach and vent care. But typically, when they say custodial care, people don't understand what that means. But custodial care, if it says we don't cover custodial care, that's probably going to be, in most cases, is going to be the personal care services that someone would receive at home. So those are some of the major payers that we run into to help pay for the services. Just kind of, again, recapping: private funds, VA, long-term care insurance policies, private insurance policies, Medicare, Medicaid. And those are
cash?
Private pay, that's cash.
Okay.
We always accept cash.
Okay.
That's not a problem at all.
But
So-
unfortunately, that's usually not the case. So it's good to know that there are alternatives to come in, that the VA can come in and help, or that there are other ways to pay.
Yeah, and there's some great benefits out there, and, my dad was a 20-year veteran in the Army.
Sure.
When he got sick and I started talking to him, it's like he wasn't even aware of what his benefits were, and it's like, Dad, you can get this benefit, it's yours. And so, one of the things that we try to do is Bayada Home Health Care in our communities that we service, we try to be a resource for the community.
Right.
We talk about these things, somebody calls us up, and our answers aren't, we can kind of give broad answers, but when we sit down with someone, we can start kind of figure out, well, do they have long-term care insurance?
Sure.
Were they a veteran? Did they, then we can kind of tailor what they're.
And you do it every day. You have staff who do it every day.
We do it every
They're really
day.
experts at it, and they know what to do.
Yeah, and it helps, because some people don't even know sometimes the questions to
You
ask.
bring up a perfect thing that something that I touched on a while back that amazed me is people don't know. People don't know their options, and that's one reason I'll go out and do these podcasts, do video blogs, do seminars, is to try to educate people on, hey, you don't have to just quietly go to the corner with your family and spend down all your assets, right? Or everyone be stressed out because they're not qualified to care for mom or dad or husband or wife, and they're doing that as a family caregiver. There are other options where you don't have to leave the home, and you can look at protecting as many assets as possible that you've worked for. So,
Absolutely.
So I think just getting this knowledge out there, and you guys being a resource to the community is a great thing.
Yeah, and that's what we try to do, and sometimes like I said, you said people don't understand, and I find that all the time.
They just haven't heard. They just
They haven't heard
It's
about
not
it.
what they do.
Exactly.
They're not.
So-
They're not an attorney necessarily, or an accountant, or a home health care provider. So they're not doing that every day. So it's just not on their radar. It's not something that they've learned about.
So we're trained to ask the questions.
Sure.
We ask the questions to try to dig down and find out what they have, and then we can help them tailor a plan that's going to fit their needs.
Sure.
And so it really becomes a puzzle sometimes. Well, you got this. Did you know you could do that? You've got this. Do you know you could do that? And
I
try
call
to
this
put
a
all the
really
pieces
cutting
together.
edge area of law, and people don't understand what I say when I say that, or what I mean when I say that, is that there's constantly things are changing, new tools and legal ways being developed to help people in situations like this that need care, and it's problem solving. It's problem solving that it's fun problem solving, and it feel good once you have provided a great service for someone and figured out how to get them that service. Once I've helped them protect some of the money and property they've worked for so long, it just feels good to do that. So
Yeah, I agree with it.
I think it's a win-win.
Yeah, absolutely.
Well, thank you, Joe. I appreciate you being here, talking about that. It's really welcome.
Okay, thank you.